This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, Senior Attending Neurosurgeon.
And I'm Dr. Alara. Today we're looking at a fascinating new study from the journal Neurologia medico-chirurgica, published in 2026. The paper is titled Association Between Early Diagnosis, Surgery, and Prognosis in Patients with High-Grade Glioma, Retrospective Analysis of a Real-World Healthcare Claims Database in Japan.
This is a crucial topic, Alara. We know that high-grade gliomas, especially glioblastoma, are associated with a notoriously poor prognosis. But what this study asks is something we encounter every day in the clinic. Does the entry point into the healthcare system, specifically which department a patient visits first, actually impacts their surgical timeline and survival?
Exactly. To answer this, the researchers used a real-world approach. They analyzed health insurance claims data from the Japan Medical Data Center Claims Database. They identified 540 patients with records of C71, which is the code for malignant neoplasm of the brain, who had also undergone the trifecta of surgery, radiotherapy, and temozolomide. This combination of treatments effectively serves as a proxy for a high-grade glioma diagnosis.
Right. That selection criteria ensures they are looking at patients healthy enough to undergo the standard of care. What was the demographic profile of this cohort?
The median age was 54 years, and about 70.9% of the patients were under the age of 60. It was a predominantly male cohort at 63.0%. The researchers then focused on a subset of 375 evaluable patients who first visited a hospital different from the one where their surgery was eventually performed.
This is where it gets interesting for our residents and students listening. When a patient presents with vague neurological symptoms, where are they actually going first in the Japanese healthcare system?
The data shows that the most common department visited was general internal medicine at 43.0%. Only 13.0% of these patients went directly to a neurosurgical department as their first stop.
And I imagine that discrepancy in the first door they walked through led to a significant difference in how fast they got to the OR.
It absolutely did. The study found that the median interval from the initial visit to surgery was 35.0 days for patients who first visited general internal medicine. In contrast, it was only 19.0 days for those who went straight to a neurosurgery department.
That's a difference of over 2 weeks. In the context of a high-grade glioma, where doubling times can be aggressive, 2 weeks is a lifetime. Did they look at a specific threshold for early surgery?
They did. They looked at the proportion of patients who underwent surgery within 21 days of their initial visit. For those starting in general internal medicine, only 37.5% hit that 21-day window. However, for the neurosurgery first group, that number jumped to 62.2%.
That is a stark contrast. Now, the million-dollar question for any neurosurgeon: did this speed translate into a survival benefit?
The results were interesting. When looking at the 3-year overall survival rates, they were numerically greater in patients who first visited a neurosurgery department, 72.7% compared to 57.7% in patients who visited other departments first.
That's a 15% difference in 3-year survival. Was that statistically significant?
Interestingly, no. The log-rank p-value was 0.39, so it didn't reach statistical significance in this specific cohort. However, the authors emphasize that the results still suggest that the treatment of high-grade gliomas was delayed if patients first visited non-neurosurgery departments, and that this delay could lead to poorer outcomes.
It's a common challenge with retrospective claims databases. Sometimes the noise of real-world data makes significance hard to reach, but the clinical trend here is hard to ignore. If you have a high-grade glioma, you want that tumor out as soon as safely possible.
Precisely. The paper concludes that their findings suggest early neurosurgery consultation and surgery may improve the outcomes of patients with high-grade gliomas. It really highlights the need for better referral pathways or perhaps a higher index of suspicion in general internal medicine.
A great takeaway for our listeners. The diagnostic journey matters just as much as the surgical technique. Getting the patient to the right specialist early is the first step in successful management. Ilara, thanks for breaking down the JMDC data for us.
My pleasure.
And thank you all for listening to the Neurosurgery Hub podcast. We'll see you in the next episode.